Hi, good afternoon, everyone. This is Eric with American Business Systems. And hey, today we're going to just dive into this whole question about medical billing, coding, billing experience. What background do you need to have, if any? Again, my name is Eric Auger. I'm the Director of Research and Development here at American Business Systems and been here 10 of the 24 years here at ABS. So it's been a privilege for me to be a part of not only American Business Systems, but the Phillips family. It's been a great, great time of my career and life, and I certainly enjoy what I do. And hopefully it comes through on our webinars that we do every Wednesday. Obviously, for those that are doing your due diligence, you want to go check out the company that you're getting in business with. And one of those areas that you can go to is the Better Business Bureau. So for whether you like them or you hate them, they're out there. They've been around a long time. Whether you are a paid subscriber or what you see here as an accreditation from the BBB or not, they are going to rate you. So it doesn't matter whether you're a member of that Better Business Bureau of that particular area. I promise you that Better Business Bureau of your area where you live in, they are going to rate you. So as you can see here, we have and maintain an A+ rating here at American Business Systems with the Better Business Bureau of Fort Worth. So you can always go check us out there. Again, as some of you have already done, we've asked you to type in your city and your state. So I want to start welcoming some of the folks that are here. Dan, I see that you're from Chicago. You were actually the first one. So I'll call your name out first. So thank you so much. Then we got Kenny from Mississippi. Good to have you here from Ocean Springs, Mississippi. Guy, you're from Salt Lake City. So some of these names are recognized. So thank you again for joining us. It was great. This last week, I got to tell you this quick story. Last week was our training week, and it's so cool to be able to show up to training. Some of you have never met. I don't know your face, but you walk up to me and go, Eric, I've seen you on so many webinars. And so there's already something we get to know. The privilege for me is that I have seen your name on these lists, but then I get to finally meet you in person. So I'm looking forward to seeing some of you. So John, you're from Albuquerque. It's good to see you, sir. Sandra from Birmingham, Alabama. Good to have you. Nick from Plano. Good to have you here. Dana from Benton, Louisiana. Good to have you. Reggie from Boca Raton. Good to have you. And Stephanie from Cookeville, Tennessee. Thank you so much. I've got a few other folks that haven't typed their names in, but that's okay. Stephen, see you there. And Miguel and Michael, good to see you, Jeff. I'll just call out your names anyway. Don, good to see you, and thank you for joining us this afternoon. If you haven't been to our website yet, go to absystems.com. When you're there, check us out. Look about us, the business package, the income potential. Underneath the business package, you'll get to see everything that you need to find out about there. Go to our YouTube channel. You can go check us out there at our YouTube channel, seeing all of our past webinars. Patrick and I were discussing this just today. We've got so many webinars out there that they just keep getting archived, more archived, and you can see here in the list how many times that those have been viewed. So a lot of them have more interest, like the demystifying marketing to doctors, and some people like the interviews and starting the business that's healthcare that's right for you. So folks, again, you can go check us out at our YouTube channel anytime. If you haven't been to our new virtual brochure, go check it out there. There you can find out about doing your due diligence, obviously how much the investment is. You'll also find out there that we do not collect any franchise fees, nor do we collect any royalty fees or any percentages from you. It is a one-time investment of the $26,990. You'll see that there, and that'll be the last thing you ever pay for us with us. But that go on to see what all you get. You get a lifetime of support, ongoing training, the live training workshop, like I mentioned about last week. You can find out all about that there and see other interviews. Well, I've already mentioned to you about Patrick Phillips. He is our founder and the CEO of American Business Systems, and not only is he that, he's the chairman of the board of the Medical Revenue Management Association of America. We're actually going to be talking about that particular group because that is the entity and the group there that actually certifies you as a certified medical revenue manager at the end of our live training. So there's a lot of benefits that you get here from being a part of American Business System. He is also a featured author in the Billing and Coding Advantage magazine, as you can see here. And then he is an author here of several books. Can't put all of them up there, but these are the ones that are pertaining to medical billing. The new thriving medical practice, we've talked about that before, especially when it comes down to marketing. But he's the co-author of that. One, Cash Crunch to Cash Flow, How to Reprogram Yourself for Success. And it's just great to have him here. I know he's working on some other books. I know that he's very, very busy, and he's was able to, again, squeeze his time in for us this afternoon. But before I bring him on, let me tell you about our next training workshop. The gentleman that you see up at the front there, that's his son, Adam Phillips, who is the president of American Business Systems. And folks, we've decided to try to call this our May training. There's more days in May that we're actually having in this training, but it does begin on April the 30th and it goes through May the 4th. So we are looking forward to having some of you have already talked with already, to be in our web training workshop. So Patrick, let's get you on the video here and let's get this thing kicked off this afternoon. Thank you for your time and spending some time with us this afternoon.
You're welcome. I'm looking forward to this one because a lot of people think that they have to have a lot of background in the medical field to be able to get into our business, and that's not true. In fact, Eric, I thought I would launch a little a poll here. Let's just take a poll from the people who are attending this today, and let's find out if there are anybody. Now, folks, when we ask this question, we mean specifically, do you have any background in medical billing? Have you actually done the billing for a doctor or been involved in medical billing with another company of some kind? We just want to know what kind of backgrounds we all have here. And I think I have launched that. Have I? Yes. Okay. And I think people are answering. Yep. Okay. Yep, good. So, folks, all you do on your screen there is just click the little dot right by the yes or the no. That'll show up on our end here. And I see a bunch of people answering. I'm going to give you about 5 more seconds to answer this poll, and then we're going to show you the results of it, okay? So let's see what percentage. Now, Eric, as you know, when we do the training classes, I ask this question up front at the very beginning of each workshop, just to get a feel, for how many people have some kind of background in medical billing, and it's generally what I'm seeing right here on these answers. So I'm going to close the poll now, and then I'll share the results here with everybody. Ready? Here we go. Only 4% of our attendees today have any background in medical billing. So, folks, the reason we wanted to share that is because that is something you need to be aware of, that we don't have to have any background at all. In fact, my wife and I had none when we started doing medical billing back in the late 80s. And here we are today, 25 years later, teaching hundreds of people really from coast to coast how to do this business. And Eric, they're from every background, right? I mean, it's just incredible. Housewives, it is. Business owners. We've got people who've never owned a business, of course, that we hold their hand through that process of getting set up as a business and choosing the name and so forth. Folks, we take everybody from scratch through this thing.
Yeah, and again, as some of you, like we see today, only 4%, which is maybe 1 or 2 people that are actually on the webinar today, actually has any background in this. But folks, don't let that, again, hold you back, because again, as Patrick said, we're going to take it, just take today. I would say this, Patrick, this is a great start of educating right now, because some of the things that we're going to be talking about today is really some of the things that we talk about in our training. And so, folks, as you go through our webinars, just don't think of it as we're trying to sell you this business. This is education. So the things you're going to learn today is going to help you move forward if you're going to be looking at that. Patrick, today I came across this article today, which is incredible, because people always want to know, is this business for real? Is this a legitimate business? Anything go wrong? And here is March the 19th. So the day is just a few days from that. This article that came out, I'll read the title, but Medical Billing Outsourcing Market. So this is from Transparency Market Research, a complete third-party group, has nothing to do with ABS. Matter of fact, if you want to go full, this is it. This is so funny, Patrick. You can go get that report, and you can pay about $4,000 to get that in-depth report that they've done. But the first part of what they said on their website is this: increasing emphasis on compliance and risk management is supporting the growth in outsourcing billing. I love what you said today when you said we're already ahead of the curve on compliance and risk management.
Yes, some of our ancillary services that we have for our licensees to offer to doctors, if they're not ready to just jump in and let you do their billing, we've got other services you can offer that just opens the door, gets you inside past that that invisible glass window there that they keep out all the germs, I guess. And yeah, it gets to the end. But you know, Eric, this is amazing because if you look at the quote there below that, it says, according to the research study, the global market for medical billing outsourcing. Now, folks, that doesn't mean to India overseas. Outsourcing is the term we use for you working out of your home in your pajamas, if you want to. You're able to run this business and do the outsourced billing for any doctor that are in your area. Anyway, it says it's expected to witness significant growth over the next few years. The presence of greater control, agility, and transparency will support the market in the near future, states the research report. So this is pretty relevant. Like you said, it was like, what, 6 days ago?
Yeah, just a few days ago. And so, folks, you can just go type in anything you want to do in Google. You know that. You can just go type in medical billing outsourcing. That's exactly what I do. Before our webinars, we try to substantiate that this is a real business. It's a growing business. Patrick, so many people say, well, what about these doctors that are moving from independent sources to these hospitals and everything else? But we still see a huge amount of doctors that are still out there that are independent, and especially those that are what we consider to be specialists. Your cardiologists, urologists, podiatry, those guys still remain independent.
Yeah, and it kind of ties in with a question here that I see in the question box there from Dan. He says, I have a friend that's a dentist and another one who's a chiropractor. They will most likely be my first clients. Will I be able to do billing for both of them? The answer is yes, Dan. You can do billing for both of those. He says, I understand that they'll not be huge clients, but they might be a good start. Of course, we don't tell you to turn down anybody that's out there that's in the medical field that you want to do the billing for. Now, having said that, we don't emphasize the dental billing that we have available for you as licensees because that market is not near as big as the medical field. Folks, think of your last time that you visited a dentist office. It's like there's crickets. You may be the only one in there sometimes because not many people like to go to the dentist. They don't have dental insurance. Dentists just don't see near as many patients. And it's a completely different type of billing too. So we tell people, look, focus on the thing that will get you started the fastest, and that's the medical people. Now, that includes chiropractors, of course. They bill on the same thing that a medical doctor does, a specialist or an oncologist does. But dental is just a completely different animal. So we tell you to hold off on that. Once you've signed up all the doctors in your area, then you might go sign up all the dentists in your area as well.
There you go. Well, continue on with the thought that Dan's asking, what we're doing right here. We also want to just talk about this graphic. Now, this one we've used in the past, Patrick, but this one's talking about the amount of money that's in billing in and of itself. And we're talking about billions of dollars, not millions, but billions of dollars.
Yes, and as you look at this, folks, just think of it this way. This says that the broader revenue cycle and technology market opportunity in billions of dollars is, as you can see there on the left in the black circle there, physician medical billing. Now, that's what you would be involved in if you get involved in our business, right? Not the technology opportunity itself. There's a lot of money that's made from doctors selling them equipment and software and types of that type of thing. But the actual physician medical billing is a $9 billion industry. And that divides into the hospital-based medical billing, which you can also do, by the way. Again, harder to get into hospitals than regular doctors, but the office-based physician medical billing is half of that. So $4.5 billion to just start with. Folks, any slice of the pie that's that big is a good one to go after.
And that's really what you were talking about with Dan. Dan was asking about dental. He's got a potential dental client. He's got a potential medical billing client. This is what we're talking about right here.
Yep.
All right. So another market analysis here is the New England Journal of Medicine. They actually say that market analysis estimates that 24 cents out of every dollar wasted on administrative and billing expenses. And Patrick, you might want to explain really where this lies. This lies at the feet of doctors that actually have they've employed their own medical biller. You know, a lot of people ask, well, what if a doctor already has their own medical biller versus outsourcing it? These are where a lot of the costs lie in, right there with an employee medical biller in the doctor's office.
Yeah, and if you think about it, 24 cents out of every dollar that comes in is wasted on those administrative and billing expenses. Because what doctors don't realize, Eric, is that it does cost them more money to hire their own people and to have the technology and the software and the user fees and the support fees and all those other things involved in keeping their own system up and running. That all goes away if they outsource it. And folks,
yes.
Now you'll hear this on other webinars. We go into more detail as to how you'll price your services, but usually people are getting 5 to 8% of whatever it is that they're collecting for the doctor. Well, so let's take that 24 cents. That's 24% that the doctor's paying to have his money collected now. What if you could cut that down to 6%? That's 1/4 of that amount. That's a huge savings for the doctor. So no, it does not cost the doctor more money to outsource. It saves them money.
It does.
And with that, I'd like to launch another poll. Can I, Eric?
Yeah, please go right ahead.
Okay, so again, I'm just interested in this crowd today that are attending this, and we had like 82 people register for this. So again, this is on a percentage basis, but I just want to know, will you be working this business full or part-time? So if you've looked into our business enough to know kind of what it's all about, would you be starting full-time, or do you have a full-time job that you work part-time at this? And folks, we have people do that. Eric, I guess in this last class, we probably had a third of the class at least that we're just going to be doing this part-time. That means they have a full-time job and they have to figure that out. We've figured that out over the last 25 years, how to get people involved in the business. And so this will give us a good feel here. I'm going to cut this off here in about 5 seconds. Eric, anything else you wanted to add to that?
No, I mean, this is great. I think it's really come out really pretty close to what we see in any of our training classes. It's sometimes 50-50, sometimes it's like it is. But yeah, I think if you show those results, it'll be pretty doggone close to what we see.
Okay, so here's the results from this poll from the crowd that's here today. We got about 57% are going to be doing this part-time. That means they do have a full-time job. And then only 43% are going to be doing it full-time, which means they're either unemployed or they're thinking that this might be something they want to move into and just do it completely full-time. So interesting, folks. The good news is that you can do that either way. It doesn't matter.
Right. You can certainly do that either way. And then one last thing, folks, you might want to get a copy of this. I mean, it's got great information in it. I mean, if you're looking at starting your own medical billing business, get some medical billing books. And this is one that we would recommend. Entrepreneur Magazine puts out one called Start Your Own Medical Claims Billing Service. You're going to find a step-by-step guide to success. And Patrick's looking that up right now. I think he's got a copy of it right there. There it is, right there.
You can get this on Amazon. It's a very interesting book. I'm not sure that anybody could actually start their own medical claims billing service with a book that's a couple hundred pages long, but it does have some good information. So again, for educational purposes, this would be a good investment to give you a feel for what this business is all about. Yeah. Entrepreneur Magazine has been around, 100 years. So it's a very reliable source for this kind of information. And they saw fit, folks, out of the hundreds of business opportunities and franchises that they talk about in their magazine, to publish a book on this particular business. And look at the quote here. Eric, you want to read the quote there from it?
Yeah, and I'd like for you to find that one little thing that's in the back of that book too, why I read this. But folks, again, this is just saying, is this business for real? And we want to establish that there is a market for medical claims, and it's exponentially growing, as you can see that. What it's talking about with legions of providers and an ever expanding patient pool, that means more people are going to see the doctor. I mean, obviously, baby boomers are turning 60 to 65 years old. I mean, I would even consider myself a baby boomer in that area because I'm 55, so I'm finding myself going to the doctor a heck of a lot more. But it's just expected to grow by 5.8% each year through 2024. So folks, this business is not going anywhere. It's established, and it is still a good business to be in.
Yes, and here's, I think, what you were looking for, Eric. That is in the back, they have a resource section, and one of the sections that they have there is on medical billing and claims businesses and clearinghouses. And look at that, we're listed in that section, the #1 company there. So
you bet.
Again, folks, we didn't even know we were in this book until we picked it up, and I looked back in the back there and I thought, where did they get that information? Well, obviously we've been around for 25 years. They can find us on the net, and that's what they did.
They did. They found us there. And so we encourage you to get it. Again, it's just a good resource for you. Stephanie says, Patrick, I'd love to quit my full-time job and put all of this project, but how long does it take to start seeing revenue?
Well, that's a good question. It depends on whether you're doing it full-time or part-time, of course. But from the licensees that come through our training, we can give you a feel for that. Some of them go out. I mean, literally, they've already talked to people before they came to the training, and they've got some people lined up. So they usually have their first client within, some of them, within the first 30 days. Now, more realistically, we're telling people, though, don't expect any cash revenue for you and your company for 60 to 90 days. Assuming that you got a client early on, you still have a little time period there that it's going to take to get that doctor's claims filed, and then to see the money actually coming in, and have a full month cycle there that you can actually bill the doctor for, because our system will tell you exactly how much money has come in for that doctor and how much you can bill them, of course, based on what percentage you choose. So we'll help you with all that, of course, when you come to the training. That's part of our lifetime support, our coaching, our mentoring from our support guys here at the office.
You bet. All right, we're going to jump right on in here about codes, and we're just going to start right off the bat, because so many people ask, who is responsible for providing medical codes? Patrick, whenever you and Linda, your wife, who really is the originating founder,
yes, right,
you already said you didn't have a medical billing background nor a coding background. Where did you get these codes from?
Well, we went to these huge books that were available that you can purchase for hundreds of dollars, literally, big, thick books that had all the codes in there already. And of course, we had to actually dig through those codes and get as many of those as we could from that book to be able to put in, because the guy that we started doing the billing for had a medical, durable medical equipment company, and he didn't know what the codes ought to be. And so his collections were just pathetic. I mean, very, very low from Medicare. Once we got the right codes in, of course, he started getting a whole lot more money. But it was all from books, basically. Now, nowadays, of course, there's places online that you could find codes as well.
But the person that's responsible for getting these codes to you are really the doctors themselves. Remember, they went to medical school. They are writing out their own notes. They know which diagnosis codes to use, which procedure codes to use. So at the end of the day, it really is the doctor's responsibility to get you those codes. And for some of those, obviously, Patrick, some doctors may want you to do some coding, but really here in the beginning, especially if the doctors are using any type of EMR system, the doctors are putting in their own codes and submitting that to their biller.
Yeah, that's right. So you're right, Eric. It all boils down to this. The only person that really can give you the accurate code for that particular encounter with a patient is the doctor themselves. Now, some doctors have hired, medical coders full time in their office to deal with the codes. That's how important they are to them. But folks, they don't have to spend that $40,000, $50,000 a year for that person, because you're going to have all the codes built into our cloud-based system. They're all there, ready for the doctor to use anytime they want to.
Yes, right. Because we've got on this next slide here. However, you might have a doctor who would like for you to provide the medical codes. And so here's where your secret sauce comes into play. Here you have no medical billing background. You have no coding background. Well, how is this done? Well, we've got two of the services that, Patrick, I know that you and I get to talk about very little of our ancillary services, but today we're kind of focusing on these two, CodeWrite and AuditGuard.
Yeah, these two ancillary services, we call them, are services that you can offer to doctors as an ABS licensee. Now, you don't have to offer these. They are just there for you to be able to offer if you need to. And in the case of a doctor asking you, well, look, I don't really know anything about my codes, whether they're right or wrong, or whether I'm using the codes that would get me reimbursed higher or lower. Can you help me with that? The answer is yes. we've come up with services, and we have over 100 certified medical billing coders behind our scenes in our network that will allow you to answer that question yes and give them all the information they need about codes for a fee. Of course, you pass on that fee to the doctor. But CodeWrite is basically, like I said, opens up a whole huge market for you as a licensee that you might not have otherwise, because you can offer coding to the doctor now. And again, our certified professional coders do everything for you. The medical charts are securely scanned into a coder's work queue for coding, as we'll illustrate here in just a minute. But the point is, you don't do the coding, our coders do the coding, and you are basically passing that along to the doctor.
Now, what you're seeing here are actually two different things here. One is obviously the service, but the other thing that you're seeing here on the screen is the marketing material that you're getting with us here. And so, folks, you don't have to go reinvent the wheel on any of our marketing. We already have, as you can see here, as you can, hopefully this is large enough that you can see it on your screen, but you can see that CodeWrite, and there's information. And what you don't see at the very bottom, there's actually room there on that particular flyer there that we can stick your logo, your contact information right directly on this piece of marketing material. But then it's kind of got the little bullet points there for quick references. But really on average, a doctor can make about a 15% improvement if they get their codes reviewed. Now, another way that they can get their codes reviewed is through using the same folks, but just using a different model here, and it's called Audit Guard. Now, Audit Guard will actually take the codes that the doctor has already filed.
I think the screen is paused. There it is. I'm sorry.
Delayed. Yeah, it was a little bit of delay there. But what this does here, it actually creates you to run some audits on the doctor's codes just to make sure that they're in the right area. I mean, Patrick, Medicare does audits. Blue Cross Blue Shield does audits. The doctors should be doing their own audits too as well.
Yes, Medicare literally can walk in off the street to a doctor's office and say, hello, we're here from the government. We're here to help you, which is one of the biggest lies ever told, right? But they will say, look, we're going to audit some of your charts here for some of your patients. So grab 50 of them and let us go through them. And if they find mistakes in there, like maybe the doctor has used a code that would get him paid a little bit more money, but it doesn't seem to fit the diagnosis, they will fine that doctor sometimes up to $10,000 per mistake. It can get very expensive.
It can be very expensive. So if anybody has questions, very focused on any of these services, we'd love to answer some of those questions. Now, we see some other questions that are coming in, but if there's any particular questions that you have, because we're going to be moving from this part of the webinar right now to some other areas. But again, folks, we want to, before we leave these two screens here and all of this information, we want you to see that these audits that the doctors you can actually provide for the doctors are in a great report. The certified professional coder will actually get on the phone with you and your doctor to show the doctor some of the areas of improvement that they could actually make. Now, this again is for those doctors that are not using our EMR system, because in our EMR system, the doctor is going to get this already. So this is another door opener. You can certainly talk about this. Patrick, I know some of our licensees that have, when they're done their marketing, because it's really up to the individual to do their own marketing, but they've actually started off with this and going to a doctor's office and just ask the person, when was the last time any of your codes or any of your doctor's codes were audited? Are you under an audit right now? And anytime you hear the word audit, people start freaking out already anyway.
Yeah, I had a licensee tell me that he would walk in and just say something about, can I speak with your HIPAA compliancy auditor? Officer, and they, of course, they don't have one, but they should have one in their office. And Audit Guard, of course, is for the codes, and so there should be somebody in charge of that in a doctor's office. But again, they're too busy. They got too many things going on, Eric. Way too much going on in a doctor's office to focus on all these different things. We can help focus the doctor and their staff on these problems and give them the solutions to them, because again, we make money off of it. The licensees make money off of it. Everybody does. And it saves the doctor, can save the doctor thousands of dollars.
One quote here from a gentleman by the name of Mike Inger. We know Mike, and he's with a company called Aviacode, and he says the average physician could increase their monthly billing by 30% if the medical coding was done accurately. So folks, this is amazing that you can see this type of movement in the cash flow for doctors just simply by offering, before you even start doing the billing, just offering the service of Audit Guard or CodeWrite, whichever they may be. You could maybe start making money immediately before you even start doing the billing. Hey, Patrick, Steven's got a question here. He says, are there territories associated with this franchise or business opportunity?
Yes, there are, Stephen. The territory is the entire United States of America. That is, you can do billing for doctors in any state. Now, the reason we don't put, we don't draw a circle on a map and say, okay, you can't go outside this circle, a territory, is because you will have doctors that you sign up, let's say locally, that know doctors in other states. And as they refer you to those doctors, we're going to show you how, using technology, completely paperless, how you can set that doctor up and start doing the billing for any doctor anywhere in the United States, including Alaska and Hawaii.
There you go.
Yeah.
He goes on, and then can we find out how many other franchisees or licensees, we call them licensees, that might be in my immediate area as far as competition?
Yes, absolutely. Just get back with the person. I'm sorry, are you saying something?
No, go ahead.
Okay, I was talking, but I thought I heard something else going on. Yes, you can. Just get back with the person who invited you to this webinar. We call them your business coach here at ABS. Just get back with that person who sent you the email about this and just ask them that question specifically about your area. They'll need to know, your city or state or zip code, that type of thing. And we can actually find if there are licensees in your area. Now, remember, the territories for that licensee is the entire United States as well. So you may run into licensees that you talk to that are in our network that don't have any doctors in your area, even though they live in your area, because there are licensees that have doctors all over the United States and they've never met any of them.
Right, that is right. Ashok, you are asking the question, and I think we just answered that for you. He says, thank you for your time and resources. But he goes, however, who would be finding clients for me? Is it me or your system? Ashok, that's one of the things you're going to learn in our live training class is how you market this directly to doctors. However, we work with you on the whole process, the whole starting from the training through us helping you do some demonstrations all the way to helping you close that client out. So we certainly are here to help you along the way.
Kind of like that. It's kind of like that old saying you've heard: you give a man, teach a man to fish, and you've taught him for life, or something like that. If we just gave you the fish, if we just gave you the clients, of course, you'd never figure out how to actually build your business way beyond that and as big as you want. The great thing is, folks, that we're going to teach you how to do marketing, but you may only have to market to one doctor. Why? Because all doctors know other doctors, and the referrals can build your business without doing a thing. I've done many interviews, Eric, you've heard them, where I've asked the licensee, what have you done to market? And they go, well, we just followed one of the ways you told us, the dozen ways in the workshop. We did that and got our first client, and then after that, we didn't do any marketing. And yet they've got 15, 20, 30 clients. Yeah.
Yes, absolutely. All right, so let's move on a little bit here. Again, we want to make sure that we are careful with your time, Patrick. And so we got some other slides to get through, and we got some more questions. We'll hopefully get through everybody here shortly. But I thought it would be good to understand the difference between someone that is a coder and then someone who is a biller, because some people that have come on our webinars before and people that we've talked to is saying, am I going to be a coder or am I going to be a biller? But folks, if you understand this, just put these two people here. A coder is someone who will take the doctor's notes and then turn them into this numerical medical code for claims processing. And then a biller would take what was done by a coder and actually input them into a billing system for payment. So that's really the difference between a coder and a biller. And what you're going to be doing is taking these codes that the doctor, whether it's a doctor or it has come from a coder, which they've taken those words, put them into numbers, and there's two types of codes. Patrick's already mentioned a couple of these already, but one is what's called a diagnosis code. This is what's wrong with you as the patient, the ailment that you may have. And then the procedure code is basically what the doctor has done for you. And Patrick, the procedure code is the important one whenever it comes down to how much the doctor is going to get reimbursed. And this is where that kind of goes along with what we were talking about earlier about the audits. That's where we see some doctors they don't know which procedure code, and they may not be getting enough money, but then some doctors may be putting a code there that's too much. That's where they can get audited and hit by Medicare.
Yeah, but it does tie together. If the diagnosis code says that the doctor thinks that the patient had a sore throat, okay, that was the code. I'm sure there's a code for sore throat. But the doctor actually put in a procedure code that said he did a appendectomy. You see, it doesn't match. And so they're not going to get paid on that. In fact, they're going to get caught.
You bet. You bet. All right. So as we kind of move forward here, the biggest thing that we want to share with you that you get to have, we're going to combine both the coder and the biller and pull it all together and certify you as what's called a certified medical revenue manager. And that will place you into the nation's largest network of medical revenue managers that is all powered by American Business Systems. And Patrick, just today I had someone ask me, if I become part of ABS, will I have a support network with the other businesses with ABS? And it's incredible. I was able to say, we're actually talking about that this afternoon. Absolutely. Yes. Everybody gets to work together.
Well, you start right there at that workshop. You're there a whole week eating lunch with, and some of dinner sometimes in the evening with other people that are there to start their business at the same time. So that's the beginning of it. But then we have an online LinkedIn group that's specifically for our licensees, where you can go in there and ask questions, and it's kind of like a forum, they used to call them, but now it's all password protected there on LinkedIn. So we use that as our way of connecting our licensees with one another.
You bet. And then Patrick, this is the certification model that people get, and the actual certificate that you handed out just this last Friday. I mean, you graduated, I don't remember how many were in there, but 20 plus people that were in that training, you handed out all these certificates.
Yeah, and we certify people as a medical revenue manager. Now, that's a particular certification that we have through an organization called MIRMA. You see their logo there on the certificate there in the bottom left-hand corner. That's the Medical Revenue Management Association of America. Yeah, and then we're going to tell you a little bit more about MIRMA right here. They basically certify our licensees when they leave that class. And so it's a very unique certification that only ABS licensees have. It shows that they've demonstrated they're fully equipped with all the training, the tools, and the support that they need to make practices more streamlined, efficient, and profitable. So you can find out more about them at mirma.org on the web.
Yeah. All right, let's get back over, before we get too far off, Don asked the question, can you talk a little bit more about the customizing of the brochures for the licensees? Yeah, Don, as soon as you become a licensee, you're actually going to get a stack of some that you can use immediately, but then there's going to be a certificate in your business package for you to get your logo put on there. You just get those ordered through support. You upload your logo to them. They get it to our printer. Then the printer turns around and mails all that back to you. So it's pretty easy for you to be able to get that done.
Yeah, and then we have an auto card system that has pre-designed postcards and greeting cards that you can then also go in and personalize with your company name and logo on those as well. That's for online marketing.
Absolutely. And then Patrick, I'm going to jump right above Don's there. Stephanie's asking the question, how much is the one-time fee to get started? And then really what's all included?
Wow. Okay. Well, there's next week's webinar. Stephanie, as Eric mentioned earlier, it's $26,990. That is our licensing fee, but that's a one-time lifetime fee, by the way. You get lifetime support. You never pay us another dime after that. And that is no user fees, no upgrades, no support fees. That's all inclusive, that one-time fee. And as far as what it includes, we do cover that in some other webinars, but you can go to our web. I think there's a tab at the top there, Eric, that says how much is the investment. And then under that, there's a little link to all the things that you get for that investment. So I just go back to absystems.com and review that.
Yep.
Or ask the person who sent you the email to this webinar. Yeah.
Yes, absolutely. So that's really what you get all, and just go check that out at our website, and then you'll find everything there. Now, a lot of people have asked, Patrick, when we're talking about these codes, now if I'm working from home, as you can say, in my pajamas, how do I get these codes? Well, folks, it can come in two different formats. It can come in, people can use still a fax machine, or they can use our electronic medical records. Actually, we have one more that they could use, which is another service that we have, which is iDocs Now. So there are actually 3 different ways that you as the medical biller can actually get these codes. And they're just simple, that they get them to you and you start plugging them in.
Right. And he just mentioned iDocs Now. That's another one of those ancillary services you can read about on our website. But folks, that has saved a lot of time and money for a lot of our licensees. It has a workflow built into it so that you can actually assign all the documents that come in are turned into electronic searchable documents. And then you can forward those to other people who work for you. Maybe you hire some other people to work with you that are working out of their home. It's all done electronically over the internet. There's no paper involved in it. And it's a wonderful way to organize your business and get it to where you can search for any document that's ever been sent to you anywhere in the future.
That's a little different from the days that whenever you and Linda were doing this, I'm sure.
Well, you're supposed to keep records for doctors, for up to 7 years. So we had file cabinets in the garage just full of documents until we got the iDocs Now and started scanning everything in. We use that here, by the way, in our offices. Folks, I think Eric mentioned earlier, or will later, that you can come visit us here in our offices in Fort Worth. Anytime, just let us know you're coming. And then when you first get there, just ask to see our file cabinets. And Hannah, who sits up front, will tell you we don't have any. Every document that comes in, every piece of paper is scanned in to the cloud that I can access from here in my home or anywhere as I'm traveling. It's a fantastic system.
You bet. Yeah, I don't know anybody that has a filing cabinet. I think my mother-in-law does, but she's from here, from back there.
Yeah.
All right, let's talk real quickly. And folks, we already told you earlier that it's the doctor's responsibility to get you the codes. So let's talk about what creates these codes, and it's called the doctor's medical decision making. We're going to kind of show you how the doctor gets to that position. So you've got this gentleman here. Obviously, he's coughing, so he's going in to see the doctor for a cough, and the doctor will actually do the examination, check the guy out, and create what's called a diagnosis code. So the guy, he says, yep, you've got a cough, and then the doctor's going to write it down as a R05 cough. Now, some people, Patrick, they still have the old things here, which would be paper, and they've got like a super bill, and then the doctor has all these codes on there already, and the doctor may just circle that instead of doing it electronically. So that can actually be done either way, of electronically or paper. But obviously, again, folks, we're letting you know that the codes are coming from the doctor. Through his medical decision or her medical decision, the doctor will then do some other things, and these are called procedures. This is a shot, maybe running a test in the office, maybe even setting up a cast for a broken arm. There's going to be actually, in this situation, a doctor's visit, which is a certain level type visit. You can see this one would be a level 3 visit. There's 5 levels. You would see that at the end of this 99213. If it was a level 4, it'd be a 4 at the end of that number. But these, you'll kind of start getting to know these as you start doing the billing. But here you got this code. That is procedure code for how much time the doctor actually spent with the patient. And then if they did something extra, like again, an injection, there's another code for that. So at this point, the doctor has 3 codes to give you as a biller. There is going to be the diagnosis code, which again is what's wrong with the patient, and then the procedure code, what the doctor did for the patient. So you can see here are the codes. And so far, Patrick, none of our heads are spinning on our shoulders so far. This is pretty simple.
Yeah. And it's all in our system. It's all given to you by the doctor and their staff through our cloud-based system.
You bet. And so it's just so easy to be able to do this. And then once now you're in our system. Now, Patrick, this is a great way. Now, before we start this, let me just share with everybody. And Patrick, you love all of our coaches to do this, and that's to demonstrate our software. You want you to talk a little bit about that before I get started here.
Yeah, folks, ours is award-winning, leading-edge cloud-based system. So if you'd like to see what you're going to be showing to the doctors that you're going to be using to do their billing, you're welcome to ask the person who sent you the email about this webinar to give you a live demo, one-on-one. Now, folks, we don't get on these demos to try to sell you or close you on buying our package. We're, again, just sharing information with you. And once you see it, you will be blown away when you realize how leading edge this technology is. Wait till you see some of the things Eric's about to show you about this.
Yeah. So, folks, we're just going to kind of step through this. This is a very high level of the demonstration that we can do for you, and we'd love to be able to do that. But
Eric,
we're going to take this. Yeah.
Can I also mention, I forgot to say that this is something we can do for you, one-on-one with you, the people here on this webinar today who are looking into getting into our business. But once you are a licensee, you can ask us through an online system that we have for licensees, go in and ask us to set up a demo for your prospective doctors. That's right. We and our staff get online using technology like GoToWebinar, GoToMeeting, and show the doctor what you're about to see, but it's live. These are just screenshots we're showing here today, but we go on live to our system and show the doctor exactly how it works. And you're going to be shocked when you hear what some of the doctors and their staff say on these demos. They get pretty carried away, don't they, Eric?
They do. Matter of fact, I'm going to do a plug for our webinar we're going to do in 2 weeks from today. We're actually interviewing one of our licensees, in which I think I'm going to be able to get to do that interview. And I did his demo. So, folks, not this next Wednesday, but the following Wednesday, you're certainly going to want to be on that one because you're going to hear directly about what Patrick just described to you. So let's talk about this real quickly so you can see what we're going to do with those codes. So if you are actually logged into the iClaim system, at this point, we would go to billing and we would click on billing. Once we're at billing, we're going to go right over to the right-hand side where it says enter professional claims charges. We're going to click on professional claims charge. And once we get there, we have already looked up the patient that we want to serve here. In this one, you can see we may have looked up this patient. Her name's Isabella Stevens. And let's say it was Isabella Stevens that actually went to the doctor. So at this point, we would scroll down to the next section down here, and you can see would be in the patient history under ICD-10. And right down hit the very bottom in the left-hand corner, you can see that number 1. As I click there, you'll see that we would put in R05. And so what you can see right there is that is the diagnosis for that cough. So we've just physically typed in that number right there. Then when we move to this section, which is just scrolling up a little bit, now we're going to place the dates of service. So we're going to place the date of service that this patient was actually seen by the doctor, and then we're going to start inputting in those 2 codes. So as we look right here, we're going to click on right there, and you can see that we would start plugging in these numbers. Once we start plugging in those numbers like that 99213, then automatically the fee schedule pops up over there, and then it totals it all up down there at the very bottom. So as you can see, whoop, it went just a little bit too fast right there. So right there, now what we've been able to do is create this claim. This claim has been created. So we put in the diagnosis code, then we put in the procedure code. Again, everything coming from the doctor to us. We can do some more diagnostics from here to make sure that these codes are still matching, just to make sure that we scrub it so we make sure that that doctor is going to get paid. And then finally, we would click on that button right there where it says create claim. And Patrick, at that point, we're on to the next claim that we need to file. And I think we've talked about it really, once you get the hang of this, even if you're doing it manually, it only takes about a minute or 2 to actually input this information into the system.
Yeah, it's so user-friendly, basically, that we can teach you in the first day of our workshop. We have laptops when you walk in the classroom. set up, and you are actually hands-on using our system over the internet in the cloud, as you would be if you were working from home, doing claims. They're fake claims, of course, they don't go anywhere, but we're going to show you how to do that. And at the end of that session, usually people are going, oh, I didn't realize it was this simple to use. Well, it's not simple unless you have a simple system.
Right, you bet. All right, let's take a few moments because we're kind of wrapping up with our slides here, Patrick, and it's about 10 till. I think we've got some time to go over some more of the questions that we have here. And I think the one that I left off here was with Dan. Dan asked the question about, is DocuSign used to sign up doctors electronically? Patrick, are you familiar with DocuSign? I don't know that we don't use it, but maybe some of our other licensees might be using that.
Yes, I do know of licensees that use DocuSign. That's not something that we have, as a part of our system. But some doctors, I know they find this hard to believe, but they still want to sign things and do things on paper, and so we make that available, for those who do. I do see a question here from Ashok about, do you have any network list of certified ABS licensees published, which can be seen by any doctor, and they can approach them for his billing needs? No, we do not have a list of our licensees. In fact, our network, even though it's nationwide, Ashok, we've been doing this for 25 years, remember, there is no way that a doctor could physically even know how to search for one of our licensees unless he went directly through our site that I mentioned earlier, the MRMAA.org, MIRMA, the Medical Revenue Managers Association of America. That association, of course, has as members all of our licensees, but we don't give that out on a public way anywhere on the internet, because you are the one that the only one that the doctor is going to know is a part of our network, and only because you made some kind of contact with the doctor. I think that's what he's getting to there is, what about the competition from other licensees? There is none, because they don't know who those people are unless they've approached them, of course. Yeah. You bet.
Kenny asked the question, any chance of getting more classes in April? Kenny, I think we only do these classes about every 6 weeks apart, and we just ended this one here, and the next one we're going to have is 6 weeks, which starts that day of April. So I know that you and I are working together. We'll be talking here. I'll make sure that clarified your question, but Kenny, we can there's some other options there if we need to look at some other options, but obviously let's see what we can do to help you get in that particular class there. Dan,
can I address this one from Dan about, can your system be integrated with QuickBooks to send invoices to doctors and keep track of our revenues and expenses? Yes, it could be. However, that's not a part of what we are supporting and teaching our licensees on, folks. When it gets into other software that's outside of our software, we don't do any support. Now, having said that, I happen to know that you can set up QuickBooks to export any data that you want in any way, or import, I should say, from our system. So it can be done, but it's not something that we're going to teach you actually how to do step by step, because many licensees use different software than QuickBooks, of course.
You bet. You bet. All right, Patrick, let's end up with this last slide here, and kind of just, we started with one group of doing some research. Now we're using Black Book rankings, and there's some of the research they've done here. And again, just addressing, how are there any doctors out there that might be looking for outsourcing needs?
Yeah, they did this answers the question. Right, they did this survey and found out that of all physician practices with employed billing staff that do their own billing, 42% of them hope to outsource their billing in the next 12 months.
Yes.
So that's a huge number. Think about it, Eric. Let's say half of the doctors out there are doing their own billing. That means 42% of that 500,000 doctors are wanting to outsource their billing in the next year. What a perfect time to be in this business. Perfectly positioned for those doctors who want to outsource their billing and realize the benefits of it. They just haven't taken the time to do that yet. They're waiting for you to call on them.
Yeah, absolutely. All right, so Patrick, hopefully we've answered the question, can you start a medical billing business without coding and billing background? The answer is absolutely yes. You can get that started. And again, it's because there's a couple of major factors here. You're going to be part of the nation's largest group of independent certified medical revenue managers. And then secondly, all the ancillary services. Basically, Patrick, we only talked about 2 of them today. The coding, both CodeWrite and AutoGuard.
Yeah, I mentioned iDocs now, but we didn't get into it. You're right. There's, let's see, a total of 7 ancillary services. So to find out about the others, you'd have to actually go to our virtual brochure on our website and click that little orange button at the top, or just ask your business coach who sent you the information about this webinar. They can get some more information to you about all of those services that are out there. Hey, Rick, can I do one more poll here?
Yeah, let's do one more. That's awesome.
All right. I just wanted to know the people that are on the webinar today, where they fall as being employed or full-time or retired or working part-time or a current business owner if you own your own business. If you don't mind answering that poll, guys, I'm going to throw the answer to that up on the screen here in about 10 seconds. But the reason we kind of like to know this is we want to reassure everybody on here that it does not take you being completely unemployed or retired. And yet we see a lot of that happening when we have these webinars that people are coming on here to find that out. So I'm going to close it right about now. Looks like everybody's answered. Oh, I see a couple of changes there to the numbers. Yeah, okay, here we go.
Okay, there we go. There we go.
All right, here's the answers. Look at that. So of all the people that are on here today, we got full-time employees. We got 43%, which means if depending on their time slot, they're actually using time of their employer to watch this webinar, or it's their day off. Let's say it's their day off. Unemployed, there's 19%. Retired, 14%. Folks, that means there's a huge, huge opportunity for you to start your own business. What other business do you know of that you can start for as little money as you would invest in this business and have a lifetime business for you that you can pass on to your family, to your children, get your children involved. If you can work with your family, some people kill each other, others can somehow do that. But anyway, I just thought I'd throw that out there and show you that. Okay.
All right. Hey, Patrick, before you've got to go, I know that you got other things that pressing in your life, but before you go, why don't you talk about the 100% money back guarantee that you got?
Oh, yeah. You know, when I came up with this a few years back, my staff thought I was nuts, including you, Eric, I might remind you, that I was saying, look, let's let people come to our training here in Dallas, sit through the whole 5 days, all 40 hours of training or more, actually, and say, what, if you don't like this for any reason, just ask for your money back. Now, people thought I was nuts when I offered that, Eric. Only a handful of people, though, in our whole history have asked for any money back. That's because once they come down here and see what they have, well, I'll tell you how to prove that. Just watch the testimonials that are on our blog out there on our website, theabsystems.com. There's a blog, look for that, and then scroll down, and you might have to go down several, and you'll see some testimonies of people who've actually just graduated from our training class here in Dallas. We'll have the one from last week probably up by tomorrow. So just go look at those and you'll see, folks, that people are thrilled. But if you don't want to be in this business, we don't want you to be in this business. We're going to give you your money back. We'll part as friends, right, and you can go open that McDonald's that you've always wanted to open and work with teenagers 80 hours a week.
Yeah, that's right. You bet. All right,
well,
Patrick.
Hey, have to run. Thank you. I appreciate it. I got to run for another meeting that's coming up here on the hour. So thanks again for holding this for us.
I'll wrap this thing up. Thanks so much, Patrick. All right, folks, if as Patrick mentioned earlier, yes, you can come by and visit with us at any time. Here's our address at 5751 Kroger Drive. We're here in Fort Worth, Texas. For some of you that live within 3 or 4 hours away from us, just drive on in, schedule that visit with us. We'd love to have you come on by. For those that are flying in, you know what? You may spend a couple of $100 to get here, get you here, get you back, and maybe even the same day. But if you're going to be investing, $27,000, it may be good for you to come by and visit with us. We'd love to have you. We can show you and demonstrate the software to you right then and there, if you'd like to, in our headquarters here. So this is one of the suites that we have here in this particular building. So feel free to come on by and visit with us.